Question 51. A nurse is assessing a newborn. What finding indicates the need for follow-up care? A. Babinski reflex is positive. B. Head circumference is 33 centimeters. C. Hips are abducted at 30 degrees. D. Umbilical cord has 3 vessels. The correct answer, C. Hips are abducted at 30 degrees. Rationale. This is limited hip abduction and is indicative of developmental dysplasia of the hip. Question 52. A nurse is assessing a group of older adults. Which should the nurse consider to be least likely to be affected by aging? A. Sense of taste or smell. B. Gastrointestinal motility. C. Muscle or motor strength. D. Strategies to handle stress. The correct answer, D. Strategies to handle stress. Rationale. Although older adults may be faced with multiple stressors as they age, how people cope with stress remains fairly constant throughout life. Question 53. Nurses who care for the terminally ill apply the theories of Kubler-Ross in planning care. According to Kubler-Ross, individuals who experience a terminal illness go through a grieving process. Place the stages of this process in the order identified by Kubler-Ross. 1. Anger. 2. Denial. 3. Bargaining. 4. Depression. 5. Acceptance. The correct order, B, A, C, D, and E. Rationale. 1b. Anger. The initial response is shock, disbelief, and denial, and the client seeks additional opinions to negate the diagnosis. 2a. Denial. When negating the diagnosis is unsuccessful, the client becomes angry and negative. 3c. Bargaining. Bargaining for wellness follows in an attempt to prolong life. 4d. Depression. As the reality of the situation becomes more apparent, depression sets in and the client may become withdrawn. 5e. Acceptance. Acceptance is the final stage of grieving. This stage may never be achieved. Question 54. What should be the initial nursing action after the birth of a preterm infant with an APGAR score of 6? A. Check and clamp the umbilical cord. B. Dry the infant and place in a warm environment. C. Obtain a footprint and apply an identification band. D. Get resuscitative equipment and assist the healthcare provider. The correct answer, B. Dry the infant and place in a warm environment. Rationale. Cold stress produces hypoxia and acidemia. Because of physiologic factors, such as lack of brown fat, the preterm infant is more vulnerable to cool temperatures. Question 55. Which is most important for the nurse to do when providing care to a client who has had a transurethral resection of the prostate? A. Maintain patency of the cystostomy tube. B. Ensure patency of the indwelling catheter. C. Keep the abdominal dressing clean and dry. D. Observe the wound for hemorrhage and infection. The correct answer, B. Discussion of plans for each of the possible outcomes of a trial. Rationale. Patency promotes bladder decompression, which prevents distension and bleeding. Continuous flow of an irrigant limits clot formation and promotes hemostasis. Question 56. A client is to receive 125 ml of IV fluid every hour. The drop factor of the IV tubing is 10 glucose tolerance test per ml. How many drops per minute should the nurse administer? Record your answer using a whole number. The correct answer, 21 glucose tolerance test per min. Multiply the amount to be infused, 125, by the drop factor, 10, and divide the result by the amount of time in minutes, 60 minutes, the product, 20.8, must be rounded up to 21 glucose tolerance test per min. Question 57. A client on a psychiatric unit who has been hearing voices is receiving a neuroleptic medication for the first time. The client takes the cup of water and the pill and stares at them. What is the most therapeutic statement the nurse can make? A. You have to take your medicine. B. Your doctor wants you to have this medicine. Swallow it. C. There must be a reason why you don't want to take your medicine. D. This is the medication that your doctor ordered for you to make you well. The correct answer, B. Your doctor wants you to have this medicine. Swallow it. Rationale. This presents reality and simply states expected behavior. Question 58. After a therapy session with a healthcare provider in the mental health clinic, a client tells the nurse that the therapist is uncaring and impersonal. What is the nurse's best response? A. Your therapist is really very good. B. I hope that the rest of the staff is caring. C. The therapist is there to help you, try to cooperate. D. You have strong feelings about your therapy session and your therapist. The correct answer, D. You have strong feelings about your therapy session and your therapist. Rationale. The use of reflection assists the client in expressing feelings, which is the major goal of therapy. Question 59. A client who has just had a kidney transplant is transferred from the post-anesthesia care unit, PACU, to the intensive care unit, ICU. How often should the nurse in the ICU monitor the client's urinary output? A. Every hour. B. Every 2 hours. C. Every half hour. D. Every 15 minutes. The correct answer, A. Every hour. Rationale. Hourly output is critical when kidney function is assessed. Decreasing urinary output is a sign of rejection. Question 60. A client who uses ritualistic behavior taps other clients on the shoulders 3 times while going through the ritual. The nurse infers that this client has A. Blurred personal identity. B. Poor control of sudden urges. C. Disturbance in spatial boundaries. D. Reduced ability to adapt to life stresses. The correct answer, D. Reduced ability to adapt to life stresses. Rationale. Ineffective coping is the impairment of a person's adaptive behaviors and problem-solving abilities in meeting life's demands. Ritualistic behavior is an impaired type of coping. Question 61. A pregnant client with severe preeclampsia is receiving IV magnesium sulfate. What should the nurse keep at the bedside to prepare for the possibility of magnesium sulfate toxicity? A. Oxygen. B. Naloxone. C. Calcium gluconate. D. Suction equipment. The correct answer, C. Calcium gluconate. Rationale. The antagonist of magnesium sulfate is calcium gluconate. Question 62. A person who is hospitalized for alcoholism becomes boisterous and belligerent and verbally threatens the nurse. What is the most appropriate response by the nurse? A. Place the client in restraints. B. Sedate and place the client in a controlled environment. C. Encourage the client to play ping pong with another client. D. Set firm limits on the client's behavior and enforce adherence to them. The correct answer, B. Sedate and place the client in a controlled environment. Rationale. The client is out of control and is dangerous to self and others. Safety requires sedation and a controlled environment. Question 63. A family of a client with myasthenia gravis asks the nurse whether the client will be an invalid. What is the nurse's best response? A. Medications will mask the signs of the disease. B. With continuous treatment, the progression of the disease usually can be controlled. C. There will be periods when bed rest will be necessary and times when regular activity will be possible. D. The progression generally is slow, so people with myasthenia will spend their younger life with few problems. The correct answer, C. There will be periods when bed rest will be necessary and times when regular activity will be possible. Rationale. This response is as optimistic as is possible while still being realistic. Question 64. A parent of a 2-year-old child who was just diagnosed with cystic fibrosis expresses concern about the child's frailty and low weight. What is the nurse's most appropriate reply? A. Digestive enzymes will be given to help your child digest food. B. Your child's appetite will improve once respiratory therapy is initiated. C. Your child's coughing and shortness of breath prevent adequate chewing of food. D. I suggest that you offer baby foods to your child because they are more easily digested. The correct answer, A. Digestive enzymes will be given to help your child digest food. Rationale. Because the pancreatic ducts are blocked and fibrotic, oral pancreatic enzymes must be given to make the nutrients digestible and absorbable. Question 65. During the first well baby visit after discharge from the hospital, the parents inform the nurse that their baby has difficulty sucking and swallowing and tires easily. What should the nurse consider when assessing this infant? A. Newborns tend to tire easily, especially when feeding. B. Decreased sucking is insignificant in the absence of cyanosis. C. Difficulty when feeding may be an early indication of a heart defect. D. Some infants retain mucus for several days that may interfere with feeding. The correct answer, C. Difficulty when feeding may be an early indication of a heart defect. Rationale. Infants with compromised heart function often become fatigued during sucking and swallowing because they have a decreased cardiac output. Question 66. For which clinical indicator should the nurse monitor a child with chronic hypoxia? A. Clubbing of fingers. B. Slow, irregular respirations. C. Subcutaneous hemorrhages. D. Decreased red blood cell count. The correct answer, A. Clubbing of fingers. Rationale. Hypoxia leads to poor peripheral circulation. Clubbing occurs as a result of tissue hypertrophy and additional capillary development in the fingers. Question 67. A nurse is caring for a client with a fracture of the head of the femur. The healthcare provider places the client in a buck extension. What explanation does the nurse give the client for why the traction is being used? A. Reduces muscle spasms. B. Prevents soft tissue edema. C. Reduces the need for cast application. D. Prevents damage to the surrounding nerves. The correct answer, A. Reduces muscle spasms. Rationale. This traction is used to reduce the fracture, align the bone, and temporarily reduce muscle spasm. Question 68. A client has a total hip arthroplasty. What should the nurse do when caring for this client after surgery? A. Use a pillow to keep the legs abducted. B. Elevate the client's affected limb on a pillow. C. Turn the client using the log rolling technique. D. Place a trochanter roll along the entire extremity. The correct answer, A. Use a pillow to keep the legs abducted. Rationale. This ensures abduction of the leg to maintain position of the prosthesis and avoid dislocation. Question 69. Which client in a psychiatric unit needs immediate therapeutic intervention from the nurse? A 50-year-old woman who is pacing around the dayroom and picking fights with other clients. B. 25-year-old man who is making sounds and actions like a machine gun in front of the nurse's station. C. 45-year-old man who sits quietly in the corner of the room, watching the movements of other clients. D. 33-year-old woman who wanders aimlessly around the unit, saying, "I just don't know what to do. I feel so lost." The correct answer, A. 50-year-old woman who is pacing around the dayroom and picking fights with other clients. Rationale. This client is demonstrating increased agitation and poses an immediate threat to the safety of other clients. The behavior requires immediate nursing intervention to prevent injury to self or others. Question 70. A client in a psychiatric hospital with the diagnosis of major depression is tearful and refuses to eat dinner after a visit with a friend. What is the most therapeutic nursing action? A. Allow the client to skip the meal. B. Offer an opportunity to discuss the visit. C. Reinforce the importance of adequate nutrition. D. Provide the client with adequate quiet thinking time. The correct answer, B. Offer an opportunity to discuss the visit. Rationale. This offers support and provides the client with an opportunity to discuss feelings. Question 71. A person with a history of alcoholism states, "I have been drinking since last Friday to celebrate my son's graduation from college." What defense mechanism does the nurse identify the client is using? A. Projection. B. Suppression. C. Identification. D. Rationalization. The correct answer, D. Rationalization. Rationale. Rationalization is an unconscious defense mechanism whereby a person finds logical reasons for behavior or feelings while ignoring the illogical or unacceptable real reasons. Question 72. A nurse is caring for a client in respiratory distress. The healthcare provider orders oxygen via a non-rebreather mask. Which mask should the nurse obtain to implement the oxygen order? The correct answer, mask number 4. Rationale. A non-rebreather mask can accurately deliver high concentrations of oxygen, greater than 90%. It cannot be used with a high degree of humidity. Question 73. The parents of a child with spasmodic croup ask why their child is receiving humidified oxygen. What effect of humidified oxygen should the nurse include in the explanation? A. Minimizes tissue edema. B. Provides a mode for giving inhalant drugs. C. Increases the surface tension of the respiratory tract. D. Provides an environment free of pathogenic organisms. The correct answer, A. Minimizes tissue edema. Rationale. Cool mist helps reduce inflammation of the upper respiratory tract. Question 74. A client has a surgical creation of a colostomy. What is the most effective nursing intervention to initially help the client accept the colostomy? A. Introduce equipment needed to care for the colostomy. B. Provide literature containing factual data about colostomies. C. Ask a member of a support group to come to speak with the client. D. Point out the number of important people who have had colostomies. The correct answer, A. Introduce equipment needed to care for the colostomy. Rationale. Beginning with equipment is less threatening and may stimulate feelings of mastery. Question 75. When planning care for a child with autism, the nurse understands that given a choice, the child with autism usually enjoys playing. A. On a jungle gym. B. With a cuddly toy. C. With a small yellow block. D. On a playground merry-go-round. The correct answer, D. On a playground merry-go-round. Rationale. The rhythmic movement of the merry-go-round provides an opportunity for the child to practice spatial and sensory orientation. This is important in helping the child increase interaction with the environment. Question 76. A client who is at 26 weeks gestation arrives at the clinic for her scheduled examination. Her blood pressure is 150/86. She tells the nurse that she has gained 5 pounds in the last 2 weeks. What is the priority nursing action? A. Test the client's urine for albumin. B. Take the client's body temperature. C. Prepare the client for a vaginal examination. D. Schedule the client for an appointment in a week. The correct answer, A. Test the client's urine for albumin. Rationale. Protein in the urine is a sign of preeclampsia, as are elevated blood pressure and weight gain of more than 2 pounds per week. Question 77. What behavior does a nurse expect of a newborn about 1 hour after birth? A. Crying and cranky. B. Hyper-responsive to stimuli. C. Relaxed and sleeping quietly. D. Intensely alert with eyes wide open. The correct answer, C. Relaxed and sleeping quietly. Rationale. It is expected that a newborn will enter a sleep phase about 30 minutes after birth. Question 78. A client who has a phobia about dogs is about to begin systematic desensitization. The client asks what the treatment will involve. What is the nurse's best response? A. You will be exposed to dogs until you no longer feel anxious. B. Rewards will be given when you do not become anxious around dogs. C. Your contact with dogs will increase while using relaxation techniques. D. There will be in-depth discussions to identify what caused your phobia. The correct answer, C. Your contact with dogs will increase while using relaxation techniques. Rationale. This accurately describes the behavioral therapy method of systematic desensitization. Question 79. A nurse is providing dietary teaching for a client who is receiving a high-protein diet while recovering from an acute episode of colitis. What should the nurse include is the rationale for this diet? A. Repairs tissues. B. Slows peristalsis. C. Corrects the anemia. D. Improves muscle tone. The correct answer, A. Repairs tissues. Rationale. Protein is required for the building and repair of intestinal tissues. Question 80. A nurse is caring for a client experiencing an acute episode of bronchial asthma. What outcome should be achieved? A. Raising mucus secretions from the chest. B. Curing the client's condition permanently. C. Limiting pulmonary secretions by decreasing fluid intake. D. Convincing the client that the condition is emotionally based. The correct answer, A. Raising mucus secretions from the chest. Rationale. In addition to dilation of bronchi, treatment is aimed at expectoration of mucus. Mucus interferes with gas exchange in the lungs. Question 81. When a developmental appraisal is performed on a 6-month-old infant, which observation is most important to the nurse in light of a diagnosis of hydrocephalus? A. Head lag. B. Positive Babinski reflex. C. Inability to sit unsupported. D. Absence of the grasp reflex. The correct answer, A. Head lag. Rationale. Head lag in an infant who is 6 months old is abnormal and is frequently a sign of cerebral damage. Question 82. A new mother refuses to look at her newborn who has a severe birth defect. What is the nurse's most therapeutic approach? A. Request that the family try to distract her. B. Clarify why she should stop blaming herself for the baby's handicap. C. Reinforce the explanation of the handicap and allow time for her to discuss her fears. D. Wait until she has sufficiently recovered from the stress of birth and then bring the baby to her again. The correct answer, C. Reinforce the explanation of the handicap and allow time for her to discuss her fears. Rationale. This approach allows for ventilation of feelings and clarifies explanations that probably were not heard or understood because of anxiety. Question 83. When teaching a class about parenting, the nurse asks the participants what they do when their toddlers have a temper tantrum. Which statement demonstrates one parent's understanding of the origin of temper tantrums? A. After a temper tantrum, I discipline my child by restricting a favorite food or activity. B. When a temper tantrum begins, I isolate and ignore my child until the behavior improves. C. During a temper tantrum, I partially gives in to my child before the tantrum becomes excessive. D. I try to prevent a temper tantrum by allowing my child to choose between 2 reasonable alternatives. The correct answer, D. I try to prevent a temper tantrum by allowing my child to choose between 2 reasonable alternatives. Rationale. This parent's action gives the child more control by allowing the child to make a decision. This demonstrates an understanding of what the toddler can and cannot do safely. Question 84. A nursing assistant interrupts the performance of a ritual by a client with obsessive-compulsive disorder. What is the most likely client reaction? A. Anxiety. B. Hostility. C. Aggression. D. Withdrawal. The correct answer, A. Anxiety. Rationale. Because the compulsive ritual is used to control anxiety, any attempt to prevent the action will increase anxiety. Question 85. When a nurse is working with a client with psychiatric problems, a primary goal is the establishment of a therapeutic nurse-client relationship. What is the major purpose of this relationship? A. Increase nonverbal communication. B. Present an outlet for suppressed hostile feelings. C. Assist the client in acquiring more effective behavior. D. Provide the client with someone who can make decisions. The correct answer, C. Assist the client in acquiring more effective behavior. Rationale. The therapeutic nurse-client relationship provides an opportunity for the client to try out different behaviors in an accepting atmosphere and ultimately to replace pathologic responses with more effective responses. Question 86. An African American woman is diagnosed with primary hypertension. She asks, is hypertension a disease of African American people? What is the nurse's best response? A. The prevalence of hypertension is about equal for women of all races. B. The higher risk population is composed of African American men and women. C. The highest risk population consists of older Caucasian American men and women. D. The prevalence of hypertension is greater for African American women than for African American men. The correct answer, B. The higher risk population is composed of African American men and women. Rationale. African Americans represent a higher risk population than Caucasian Americans for hypertension, the reason is unknown. Question 87. A healthcare provider prescribes a diuretic for a client with hypertension. What should the nurse include in the teaching when explaining how diuretics reduce blood pressure? A. Facilitates vasodilation. B. Promotes smooth muscle relaxation. C. Reduces the circulating blood volume. D. Blocks the sympathetic nervous system. The correct answer, C. Reduces the circulating blood volume. Rationale. Diuretics block sodium reabsorption and promote fluid loss, decreasing blood volume and reducing arterial pressure. Question 88. A nurse is caring for a client who is receiving a thiazide diuretic for hypertension. Which food selected by the client indicates to the nurse that dietary teaching about thiazide diuretics was effective? A. Apples. B. Broccoli. C. Cherries. D. Cauliflower. The correct answer, B. Broccoli. Rationale. Thiazide diuretics are potassium-depleting agents. Broccoli provides 267 mg of potassium per 100 grams. Question 89. A 20-year-old college student comes to the college health clinic reporting increasing anxiety, loss of appetite, and an inability to concentrate. What is the most appropriate response by the nurse? A. With whom have you shared your feelings of anxiety? B. What have you identified as the cause of your anxiety? C. It has been difficult for you. How long has this been going on? D. Let's talk about your problems. Are you having difficulty adjusting? The correct answer, C. It has been difficult for you. How long has this been going on? Rationale. This response acknowledges feelings and attempts to collect more data. Question 90. A nurse is caring for a client who attempted suicide. What is the most desirable short-term client outcome during this crisis situation? A. Strengthening coping skills. B. Establishing a no-suicide contract. C. Learning problem-solving techniques. D. Recognizing why suicide was attempted. The correct answer, B. Establishing a no-suicide contract. Rationale. The primary goal is to keep the client safe. A no-suicide contract secures the client's agreement not to attempt suicide for a specified period and to seek help when suicidal ideas increase. Question 91. A 32-year-old child is admitted to the hospital for an appendectomy. What should the nurse use to best prepare the child for the hospital experience? A. A diagram. B. Puppet play. C. A storybook. D. Therapeutic play. The correct answer, D. Therapeutic play. Rationale. This allows the child to manipulate unfamiliar equipment. This action tends to reduce the stress of hospitalization. Question 92. A client with adrenal insufficiency reports feeling weak and dizzy, especially in the morning. What should the nurse determine is the most probable cause of these symptoms? A. A lack of potassium. B. Postural hypertension. C. A hypoglycemic reaction. D. Increased extracellular fluid volume. The correct answer, C. A hypoglycemic reaction. Rationale. Deficiency of glucocorticoids causes hypoglycemia in the client with Addison disease. Clinical manifestations of hypoglycemia include nervousness, weakness, dizziness, cool, moist skin, hunger, and tremors. Question 93. A client is admitted to the hospital with a diagnosis of chronic kidney failure. For signs of what electrolyte imbalance should the nurse monitor the client? A. Hypokalemia. B. Hypocalcemia. C. Hypernatremia. D. Hyperglycemia. The correct answer, B. Hypocalcemia. Rationale. Hypocalcemia, decreased calcium in the blood, occurs because of the reciprocal relationship with phosphorus, which is increased by the decreased glomerular filtration rate. Question 94. During her 6th month of pregnancy, a woman visits the prenatal clinic for the first time. As part of the initial assessment, a CBC and a urinalysis are performed. Which laboratory finding should alert the nurse that further assessment is required? A. WBC count of 9,000 per cubic millimeter. B. Hemoglobin level of 10 grams per deciliter. C. Urine specific gravity of 1.020. D. Glucose level of 1+ in the urine. The correct answer, B. Hemoglobin level of 10 grams per deciliter. Rationale. This reading suggests a true anemia. The lowest hemoglobin resulting from physiologic anemia of pregnancy is 12 grams per deciliter, which occurs because the plasma volume increases to a greater extent than the RBCs during pregnancy. Question 95. 2 hours after an uneventful labor and birth, a client's uterus is 4 finger breadths above the umbilicus. After urinary catheterization, the fundus remains firm and 4 finger breadths above the umbilicus. What is the priority nursing action? A. Recheck the vital signs. B. Catheterize again in 1 hour. C. Notify the healthcare provider. D. Palpate the fundus every 2 hours. The correct answer, C. Notify the healthcare provider. Rationale. The increased height of the uterus may result from accumulation of blood in the uterus from internal hemorrhaging. Vital signs may be indicative of impending shock. Question 96. A client receives spinal anesthesia during labor and birth. 24 hours later, she tells a nurse that she has a headache. Which statements indicate to the nurse that the headache is a reaction to the anesthesia? Select all that apply. A. I have ringing in my ears. B. It improves when I lie down. C. Bright lights really bother my eyes. D. It gets better as soon as I walk a while. E. My head hurts more when I am sitting watching TV. F. My head hurts more when I am lying on my side breastfeeding. The correct answer, A, B, C, and E. Rationale. A. Central nervous system, CNS, irritation can cause auditory problems such as tinnitus. B. A headache resulting from spinal anesthesia usually occurs 24 to 72 hours after its administration. Postural changes cause the diminished volume of cerebrospinal fluid to exert traction on pain-sensitive central nervous system structures. The client is most comfortable when lying flat. C. Central nervous system irritation can cause visual problems such as photophobia and blurred vision. E. The headache lessens when the is lying flat. Question 97. A client has a history of hypothyroidism. Which skin condition should the nurse expect when performing a physical assessment? A. Dry. B. Moist. C. Flushed. D. Smooth. The correct answer, A. Dry. Rationale. Dry skin is caused by decreased function of sebaceous glands, a paucity of thyroid hormones triiodothyronine, T3, and thyroxine, T4, which control the basal metabolic rate, can alter the function of almost every body system. Question 98. A nurse is caring for a client who has had an open reduction internal fixation of a fractured hip. Which nursing assessment of the affected leg is most important after the surgery? A. Femoral pulse. B. Toes for mobility. C. Condition of the pin. D. Range of motion of the knee. The correct answer, B. Toes for mobility. Rationale. Monitoring the mobility of the toes assesses neural integrity distal to the surgical site. This is part of a neurovascular assessment. Question 99. A nurse is caring for a client with myxedema who has undergone abdominal surgery. What should the nurse consider when administering opioids to this client? A. Tolerance to the drug develops readily. B. 1/3 to 1/2 the usual dose should be prescribed. C. Opioids may interfere with the secretion of thyroid hormones. D. Sedation will have a paradoxical effect, causing hyperactivity. The correct answer, B. 1/3 to 1/2 the usual dose should be prescribed. Rationale. Because of a decreased metabolism, the usual adult dose of an opioid may result in an overdose. A decreased basal metabolic rate prolongs the time for drug detoxification and elimination. Question 100. A nurse is caring for a child with spasmodic croup. Which clinical finding alerts the nurse that immediate nursing intervention is required? A. Irritability. B. Hoarseness. C. Barking cough. D. Rapid respirations. The correct answer, D. Rapid respirations. Rationale. Rapid respirations may be a sign of impending airway obstruction.